Hi, my name is Maddie Keeley and I'm a former HOSA student. I'm studying pre-nursing at the University of Arizona and I'm currently a CNA. So I am going to perform ostomy care on my patient. I'm going to assemble my equipment and supplies. I would make sure to wash my hands and I'd make sure to knock before entering the room. I'd greet my patient and introduce myself. I would then explain to the patient that I'm going to take care of their ostomy. Then I would lower the side rail if it was indicated. I would make sure to put on gloves, and I'd make sure their patient is laying on the back if they're able to. And I'm going to place a disposable protective pad underneath my patient. Just fold it underneath them. We can assist them up. Place it underneath them, and then we will place another one on the side of them, like so. Then I'd make sure to cover them with a bath blanket. And I'm going to fan fold their sheet down so that their clean sheet is not getting dirty, but making sure they're completely covered by that bath blanket. Alright, so then we're going to move the top linens down to expose the stoma or ostomy pouch. And we will make sure we have both of our pads placed down. We're gonna gently pull on one edge of the ostomy to burp it a little bit. Just gently pull on it to release some air. And then you'll remove the ostomy pouch carefully and place it into a plastic bag. From there, you're going to wipe around the stoma with disposable wipe and dispose of that properly. And then you're going to take a washcloth and using warm water, washing in one direction away from the stoma. And then make sure to grab a different washcloth and rinse off what you just did. And then you're going to pat the area dry with a towel. And then you're gonna temporarily cover the stoma with a wipe while we're doing some other stuff. And then also, if it has to be, we're going to apply deodorant, but that's only if it's indicated. And then I would also make sure that I note the color, of the stool, the amount and consistency in my ostomy bag that I discarded. Then I'm going to apply a clean ostomy pouch onto my patient by holding in place and securing the seal and making sure the bottom of the pouch is clamped. And then I would make sure to remove my bed protectors and dispose of them properly. And remove the one underneath my patient, making sure to roll in the soiled part of it. And then I'm going to make sure to pull up my patient's sheets. And dispose of my bath blanket into a dirty linen hamper. I'd make sure that I would dispose of all the plastic properly, remove and discard my gloves. I'd make sure my patient feels comfortable. I'd return the bed to its lowest position and leave the call light with my patient. and I'm going to wash hands. I'm going to document my skill and everything that I recorded about the stool. I would report any changes to my head nurse, and I appropriate verbal communication with my patient, and I practice standard precautions throughout the skill.